I'm Dr. Jen with White Wave Bodywork, and in this video what I want to talk to you about is breathing to support the rectus abdominis and the pelvic floor. So come to a comfortable seated position where you feel like you can get your knees below your hips and a little dip in your lower back. Right now I have one pillow up underneath my bottom and I'm sitting on the edge of that pillow so my feet are flat on the floor. So my knees can drop a little bit lower than my hips and I can feel that dip in my lower back. You may need more than one pillow to raise your butt up higher. I'll show you what that looks like. And how it can kind of help shift me a little more upright and forward. Do you see how I have more availability to rock my hips forward when my butt is a little bit higher. It creates more of a dip in my lower back and it just anteriorly rotates my pelvis a little bit more. What we want when we're trying to activate the pelvic floor is a slight anterior tilt of the pelvis in general. Now some people have back issues where that anterior tilt is not comfortable or available to them, and in that case you want to be back a little bit farther. But for the general population, we do want knees lower than hips and a little robin's egg shape in the lower back. Just make sure that that feels good to you, that the lift feels better to you than being flat on the floor. Just check in with your body and see where you're at today. So from here, what happens with the pillows underneath us too is that it provides a little bit of a support up into the pelvic floor. I can feel that pillow right on my sits bones and underneath, like right into the vaginal area. So what I want you to do is try and see if when you're breathing and you're inhaling, that pelvic floor can descend down into the pillow, and as you're exhaling, the pelvic floor can rise back up. So there's a gentle descending happening as you're expanding and inhaling. And then as you're exhaling, the pelvic floor pulls up and in gently and rises away from that pillow. Inhale, the pelvic floor descends. Exhale, the pelvic floor pulls up away from the pillow. So just that gentle awareness of the pelvic floor and that movement can help strengthen the pelvic floor. What we want is for that movement to just be innate, to just happen. But a lot of the times the way that we spend our time in different postures or with pregnant pressure down through the pelvic floor for months at a time, growing and growing, the pelvic floor kind of gets turned off. Just like after surgery in PT, we see people that have like ACL surgery and then their muscles are completely turned off, or they have a knee replacement, their muscles just shut down. It's a very similar concept to when something's had pressure for an extended period of time, it just stops doing its job as well as it had done before. So with this conscious awareness of that breathing affecting the pelvic floor and a little bit of contraction on exhalation and a little bit of relaxation on inhalation, we can restore that muscle's innate ability to do the thing naturally that it should be doing. So we're set up in a good posture, we're focusing on that rising and falling during breathing, and there's a couple different components of it. It's not just the pelvic floor that's moving, it's this whole pressure system that's moving. So the pelvic floor could be considered a diaphragm that moves, as well as our actual diaphragm that has that name in between our rib cage. So the pelvic floor is a network of muscles here, the diaphragm is a large muscle here, and as we breathe, they descend as we inhale, they rise as we exhale. And we want to try to do that with this whole conscious awareness. So as you inhale, really try to utilize the rib cage to expand and descend that diaphragm at the same time that you relax and descend the pelvic floor. Inhale, descend. Exhale, the rib cage will naturally just draw back in as that diaphragm rises. And I want you to do a conscious awareness of a pulling up and in. So this is a gentle pulling up and in of the pelvic floor. This is like pulling a tissue up inside you, or just trying to zip a zipper on a tight pair of pants. What you're trying to do is just lift up and in. And that zipper, the same thing happens with the belly button. We're lifting up and in with the belly button. Just like you're putting on a tight pair of jeans, you're pulling the belly in. So inhale, everything relaxes and descends, expands. And exhale, there's this pulling the zipper up a tight pair of pants, pulling up and in. The pelvic floor comes up and in, the belly button comes up and in. Now when we're pregnant, a lot of times the expansion is all happening here, and there's not a whole lot happening back here. So we can utilize the breath as a way to stretch from the inside, these muscles that get tight on the lateral sides of our body and the back of our body. So what I want you to try to do is, with this breath, really expand the rib cage out into the side and expand into the back ribs and the back waist as you inhale. So it's a very three-dimensional breath, not just this belly breathing. And as you exhale, draw the pelvic floor up and in, belly button up and in. Inhale, expand the back ribs. And exhale, pelvic floor up and in, belly button up and in. So just exploring the availability of that, I think, is a really helpful technique for trying to maintain an awareness around your breath pattern and maintain some strength with the pelvic floor and the abdomen during our pregnancy. I hope you found that helpful, and leave me some comments in the comment section below if you're watching on YouTube, or send me a message and let me know what you think of that. Thank you so much. Have a great day.